A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
In 2021, it's estimated that more than 281,000 new cases of invasive breast cancer are expected to be diagnosed, along with more than 235,000 new cases of lung cancer. Today, we'll talk about women's breast imaging and lung cancer screening and how early detection could save your life. We'll get the life-saving information you need on this edition of your Hometown Health Connection. I'm Samantha Latshaw. Welcome to your Hometown Health Connection. Healthcare professionals are shedding light on cancer screenings and the impact of COVID-19 that has had on those seeking treatment. According to the American Cancer Society, between March and May of 2020, screenings procedures have dropped dramatically. Joining us is Dr. Anna Chen. Dr. Chen is the Director of Women's Imaging at Winsong. She is board certified in both women's imaging and cross-sectional radiology. We also have Dr. Raja Cherivu. Dr. Cherivu is the director of Winsong's lung cancer screening program. He is a board certified radiologist at Winsong Radiology, specializing in cross-sectional imaging. Dr. Chen, welcome. Thank you so much for joining us.
Thank you.
Let's talk about breast cancer. Why is it so important to get screened?
So we all know that screening studies are important for detection of cancer. The whole premise behind screening studies is to pick up a cancer early before you have symptoms. And same thing applies with the breast screening studies. The earlier we find a cancer, the better the prognosis and the easier the treatment for the patient.
Now, how early is early? What do you recommend?
Well, we recommend mammograms beginning at the age of 40 and every year thereafter for average risk patients. Some patients that might have a stronger family history may need to come in earlier, but they should go through genetic assessment to see if they do need to come in earlier than age 40. But usually the general population, we like people to come in at age 40 and then screen every year following.
I was actually having this conversation with my mother yesterday, telling her that she has to get her screening done because you mentioned it's every year after 40 years old.
Every year, yes.
She's overdue. Now, talk to me about the self-exams. Self-exams at home, you can conduct them yourself. What should you be looking for when you're trying to examine yourself at home?
So I'm a big proponent of self-breast exam. I always tell my patients that it's important to get to know what your normal breasts feel like. I do recommend it to do it regularly, so once a month. For those that are still menstruating, I say to do it right after their menstrual period because that's when their breasts are least active. And then once they get to know what their normal lumps and bumps feel like. And so what you're looking for is to feel any kind of abnormal mass or some sort of abnormal thickening. You look for any kind of abnormal skin changes like dimpling or a rash near the nipple, discharge coming from the nipple, and of course, anything that you feel that feels a little different, that just doesn't feel right to you. And that's why I say it's so important to get to know what your normal breasts feel like, because you may be the first person to pick up something that just isn't right to you. And you may pick it up before your physician, who sees you, I think, once a year.
Yeah, no, that's very important. So I guess what you're saying is to perhaps establish a baseline so that way you know what your normal tissue feels like, and that's best to do so after your cycle.
Right, and most people don't realize that your breasts change. Right? Everybody thinks your breasts stay the same, but they don't. We have hormonal variation, so your breasts will change. They will change in their, what I tell people, their lumpy bumpiness, because not everybody's breasts are smooth. Nobody's breasts are smooth, I should say. And you get to know what your normal breast feels like.
Now, is this best done standing up, laying down? What's the best method to check yourself out?
I think it's good to do it in different varying positions. I always tell patients if they want to first start out to try to do it in the shower because it's easier with water and soap, and then it's easier to move around. And the most important part is to make sure that people extend up into their axillary region and the armpit area, because breast tissue can reach up into that area.
Wow, so go into the armpit area.
Yes.
Now, if you find something unusual, you notice, you're doing this once a month, you're accustomed to now what your normal is, what should you do?
So first, I wouldn't panic. right? If you feel something that doesn't feel right, I would inform your physician, have them take a look, because most of the time when people feel something, it's usually nothing, right? But if your physician is also concerned or feels something, they may send you for additional imaging, where I would come into play, and then we would assess things and do the tests that we need and find out what the problem is, and if it's nothing to worry about or if it's something that we need to delve further.
Now, we mentioned the mammogram screening should be done at least once a year after 40. A lot of people skipped their mammogram screening during 2020. What do you have to say about that? People should still come in, absolutely, it's safe, and why should they not skip their mammogram if they happen to be scared because of COVID?
So, I know everyone's worried about COVID, but we have done a lot of things at Winsong to help make it safe. So we have supplied social distancing. We have added screening of temperature taking. We have interview questions. We require everyone to wear a mask when they come in, as well as our staff to wear masks. And we have done enhanced disinfecting. So it is a very safe place to come for your screening study. I would say if you missed a year or you are overdue, please come in, because it is very important. Our main objective is that, like I said, we want to pick up cancers early, and what we're looking for are subtle changes from year to year. So if you skip a year, it could make a difference.
Absolutely. Now, if someone says they still want to wait, how long can you wait?
Without knowing how long the pandemic is going to go on, I think it's really important. I really don't want to give a time frame, because I want to encourage all women to come in. If you are due or overdue, I think it's very important for you to come for your screening study. I will say a lot of my friends, sometimes when they used to be worried and then they waited, and then the longer they waited, the more nervous they got. So I would say, to relay your fears and to make you less nervous about your breast cancer screening, it is safe to come in.
Absolutely, because you mentioned you guys are taking the safety precautions, and it is very low risk to actually contract COVID at your facility.
Correct.
Now, there have been some reports with swollen lymph nodes, swollen lymph glands in the armpit area after receiving a COVID-19 vaccine. Can you please talk to me about that?
Absolutely. This has actually received quite a lot of media, and I'm quite surprised, actually. I do know it's a concern. I'm just surprised at how much people have been talking about it. So with the initiation of vaccines, it is the body's normal response to get enlarged lymph nodes on the side that you had the vaccination. It is a normal response. I don't want people to think, though, if they don't feel abnormal lymph nodes, that they're not getting a normal immune response. So it's just something that can happen with vaccinations. We happen to be seeing it more often, I think, because of this mass vaccination system, this process that we're going through right now. So it's definitely not something that's abnormal, but it is something that we look for on a mammogram. Can it be a concern? If you've had a vaccine, probably not. But we would like to do an assessment. What we typically do is we usually do an ultrasound, or what we call a sonogram, which will look in the armpit area to see what your lymph nodes look like. A lot of the times, lymph nodes that are reacting to the vaccine have a typical appearance. And then what we like to do is have a follow-up study about 3 months' time after their second shot, to make sure that the lymph nodes are starting to go back down to their normal appearance.
Now, this is because of the new phenomena with COVID vaccines being administered, that we're doing that follow-up.
Correct. I think the reason why we're seeing it so much more now, like I said, is because of this mass vaccination that we're doing. And I will say most patients will only require one follow-up sonogram. I will say every patient is a little different, so I can't promise that it would just be one sonogram and that you won't have additional imaging, because if we see something else that we need to check out as well, we certainly won't ignore it. But most people should probably be fine with just one follow-up study.
Absolutely, and I just want to drive home that this is normal. This is your normal body reaction to the vaccine. There's nothing to be afraid about this happening to you once you receive the vaccine.
Absolutely. It is a normal body response. It's actually a sign of a healthy immune system, and that you are reacting to the vaccine in a totally appropriate manner.
And is there a time that you recommend between the vaccine to see you once you receive the vaccine for the screening?
So if someone's coming in for their screening and they're trying to time it, we do say that it's probably better to do your screening study before you have your vaccine. But with all the problems with getting a vaccine and not knowing when you're going to get your appointment, we certainly don't want you to have to juggle both. So we do say that with the importance of screening, we don't really want to time it with your vaccine, that you should just come in if you're due for your screening study. If you do want to try to time it, we say it's best to do it probably about 6 to 8 weeks after your second dose.
After the second dose.
Correct.
And of course, that's to get a better look so that there's no interference with the glands there and if they are swollen.
Correct.
Now, doctor, when you go in for your annual exam and the doctor performs a clinical manual exam on you, that's not good enough, right?
It's a good exam, but it's not a screening study imaging-wise. So the screening study, the mainstay, the gold standard is a mammogram. So that helps us look into the breast, or I should say through the breast, so that we can pick up a cancer actually before it's felt. Because a lot of times we want, when you do a clinical exam and someone feels something already, it might be a little bit of a later stage than picking it up before anybody can feel it.
Right, so it's a good exam, but it does not give you the leeway to skip that for a mammogram. It does not take the
Absolutely
place.
not.
Now, are there other alternatives to a mammogram, some other types of screening procedures that could be involved?
Sure, there are actually 2 other mainstay type of screening studies that someone can have. There are sonograms, or what other people have heard of, what called ultrasounds, which are a different way to screen the breast tissue without any radiation. We actually use it as a supplemental screening tool in addition to a mammogram, because it can help find things that we either are trying to look at differently on the mammogram, or it may pick up things that we won't see on a mammogram. And the other test out there for high-risk patients, we do breast MRI screening studies as well. And by high risk, I mean patients that carry a genetic mutation or have been found to be at higher risk than the general population. And that looks at the tissue, again, in a completely different way that could pick up a cancer that we don't see on any other imaging.
Now, if you are someone that perhaps your mother or sister or an aunt, how far back is that something that will be cause for you being perhaps a genetic higher risk patient?
The first thing we look at are first degree relatives, which would be mother, sister, father, brother, in your immediate family. But it doesn't mean that we don't count second degree relatives as well. So as genetic counselors often do, they do a family tree, and if they find a significant history of cancer dating back, it may be more important to find which side of that family has it and who has it. But as a quick screen, when someone comes in, it's usually immediate family members that that signal us first.
And do these genetic testings, are they available at Winsong?
Winsong does have a genetic counselor, so that people can have a counseling session with the counselor, and they can further go through their history and see if they're a candidate for genetic testing, which would be able to determine their risk.
Now, Dr. Shen, early detection, early screening is key. It can save your life.
Absolutely.
If you could please talk to me about the importance of that, and just, there are people perhaps that are scared, and it's so important to come see you in time.
I will just have to stress, it is important to have a screening study. I have been in practice for over 20 years now, and I see many women, and it's nice to actually see many of the women that we diagnose early, and they come back, and it's just wonderful to see. They have a great prognosis, and it's like they never had cancer in the first place, and it's such a great life-saving tool that I can't stress the importance of just starting to have your mammograms and have it yearly, because again, our main objective is we're looking for subtle change from year to year, and we want to try to pick up the cancer when it's at its smallest stages.
Thank you, doctor. How can we make an appointment?
So they can either call our office or they can make an appointment on our website at winsongwny.com.
Thank you so much for sharing this vital information. You really brought it home. You mentioned that you can make it feel like as if you don't even have cancer, because we can be able to get through this from an early detection.
Absolutely. Thank you.
Thank you. We will have much more on cancer screenings, but before we cut to break, a reminder that you can connect with Dr. Shen and Dr. Cherivu at Winsong Radiology. Their phone number is 716-631-2500. Ahead, should only people with a history of smoking be screened for lung cancer? We have the answer when we come back.
Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living Magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living Magazine all over our hometown or go online anytime at buffalohealthyliving.com.
Welcome back to your Hometown Health Connection. I'm Samantha Latshaw. We're continuing our discussion about cancer screenings with Dr. Raja Cherivu. More people in the United States die from lung cancer than any other cancer. Doctor, why is that?
Well, very good question, Samantha. The single biggest reason why lung cancer is the #1 killer in America is smoking. 85% of lung cancers are attributed to long-standing smoking use. So in fact, lung cancer, your viewers may or may not know, is the #1 cancer killer in America, and it actually exceeds the number of cancer deaths attributable to prostate cancer, breast cancer, and colon cancer combined. So a very serious disease.
Now, those who do not smoke are also could develop lung cancer as well, correct?
It's true, but 85% of lung cancers are directly attributable to smoking, and there are environmental factors, pollution, asbestos exposure, there are other things, but for the most part, smoking is the #1 reason that people develop lung cancer.
Talk to me about the screening. What's involved in those methods?
It's really simple. I'm glad you brought that up because, the first thing patients ask is, is it going to be painful? Is it going to take a long time for me to get? They're obviously nervous and anxious about a potential diagnosis of cancer. And I think that what that you need to understand is that it's a very simple test. You come in, you come into the facility, you don't need an injection, you don't need any of that sort. You just get a CAT scan, which I think a lot of your viewers might have already had. Just go into a small room, you're lying on a table with a little donut-shaped tube, and literally the scan takes 3 minutes. And you're in and out the front door in 30 minutes time. So it's a non-invasive procedure, very simple, and as it stands today, it's actually covered by insurance, so it's a free preventative exam.
Wonderful. Now, with the CAT scan, by chance, is there iodine involved? Because I know some people are afraid of that feeling sometimes.
Sure, very good question, Samantha. Actually, in this particular case, there's no iodine. In some CT scans, we do actually inject the patient with iodinated contrast, but with the low-dose CT we perform, there's actually no needle, there's no iodine, none of that stuff. So it's quick and easy. Just come in there, get the scan done, and go home.
That sounds like definitely a very easy procedure, so no need to be scared there.
Fear should not be a reason to not get the exam, that's for sure.
Now, people with a history of smoking, should they be screened for lung cancer? You touched about it earlier, but if you can just dig a little deeper for me in the importance of smokers and why they should be checked.
Well, as I said earlier, 85% of lung cancers are attributable to a long-standing smoking history. So the way it's set right now, if a patient has a 30-pack year history of smoking, in other words, they've smoked 1 pack a year for 30 years, 2 packs a year for 15 years, so on and so forth, and still smoke or have smoked or quit smoking within the last 15 years, they qualify for lung cancer screening. The good news is that those criteria actually changed for the better. So we're going to actually have, in the next few months, I'm hopeful that patients who have a 20-pack year history of smoking and of course, still smoke or have smoked within the last 15 years are eligible for lung cancer screening. And also good news is that the age criteria has been reduced. So in the past, patients who had to be at least 55 to 80 to be eligible for lung cancer screening, and that's soon going to drop from 50 to 80. So it's going to double the number of patients who are eligible for free lung cancer screening.
Absolutely, that's very important. Now, this criteria is specifically so that insurance covers it?
Yes, so if you have one of the local carriers, of course the patients need to check with their insurance plan, but according to the Affordable Care Act actually requires that all private carriers provide lung cancer screening without cost sharing. So in other words, there is no deductible, there's no out-of-pocket of expense. But of course it's very important to check with the insurance company before you schedule the exam, but that's the way it works right now.
I see. So if perhaps you smoked, but perhaps less than that criteria, what would happen then if you want to get screened?
Well, I mean, you can always pay out of pocket, of course. Unfortunately, if you don't meet those criteria, you're not eligible for screening. But if you're less, if your smoking history is less than that, then your chance of lung cancer are also lower, of course. So these criteria, there was a lot of thought going into the criteria. So if you meet those criteria, then you're of course eligible for screening. And if you don't meet those criteria, then you can't, at least for free. But like I said, we really want to capture those high-risk patients, and if you don't meet the criteria, you're probably lower risk and perhaps not as likely to develop lung cancer.
Now, you mentioned that they opened the age group to be a little younger now for
Yes.
screening. Why do you think that is?
Well, I mean, I think the United States Preventive Services Task Force, which is the federal governing body that regulates these type of things, realized that lung cancer screening works. There was actually a very large trial with 50,000 patients conducted in the early 2000s, the National Lung Screening Trial, and that showed that there was actually a 20% mortality reduction in patients who received low-dose lung screening. So in other words, for every 10 patients who died who did not get the low-dose CT, for those who did get the low-dose CT, only 8 died. So there were 2 saved lives for every 10. So that's huge. In medical numbers, a 20% mortality reduction rate is huge. So the United States Preventive Services Task Force actually saw that. That trial ended in 2009, and then at that point, they actually mandated or put into play low-dose CT as part of the screening armamentarium for patients. And then over the last few years, they've shown that mortality reduction has actually gotten better, and realized that, wait a second, let's expand the criteria and hopefully save more lives.
Now, you mentioned the age, but I just want you to drive that home. What is that golden age number that we're looking for screening to begin?
50.
50.
So like, let me be clear, Samantha. So as it stands today, it's 55. We're very hopeful in the next few months with the new guidelines that age cutoff will be dropped to 50.
Now, what if we touched on it earlier, you can pay out of pocket, but if they don't qualify for the eligibility, but what if your doctor wants you to get screened? Does that help in any way to get this type of screening done?
Yeah, of course. I mean, if you have, the whole point of screening, Samantha, is that patients are theoretically supposed to be asymptomatic, and that's why we do the screening. But of course, if patients have any symptoms of any sort, be it chest pain, shortness of breath, coughing up blood, what have you, then of course the doctor can order the scan and we can test that way. But for the purpose of this discussion, I'm talking about patients who are asymptomatic, meaning no shortness of breath, no cough, nothing.
Now, in comparison to the low-dose type of exam screening, how does this compare, and does it save lives?
Yeah, well, I mean, we use the word low dose, meaning that it's basically the same CAT scan that a lot of patients and a lot of your viewers have had. It's just that we reduce the radiation dose just a little bit, because the one risk, and I use that lightly, is that the one risk of the low-dose CT is that you're unnecessarily exposing patients to radiation. I would make the argument that in this high-risk group that obviously tends to be a little older, the risk of radiation is minimal. So, you know, obviously we don't want to do a scan on a 15-year-old girl. That wouldn't make sense, especially obviously an asymptomatic person. You wouldn't want to necessarily expose a young person to the radiation, but someone who's 50, 60, 70, the radiation risk is very minimal, and of course the benefits outweigh the risk in terms of benefit saving a patient from potential lung cancer versus the risk of radiation exposure.
Absolutely. So low dose, that's really great to hear, because you can experience low dose radiation when just flying on a plane.
Oh, of course. It's very low dose, and like I said, that's one concern that patients might have, and they shouldn't worry about it, because of course the benefit of the screening exam and potentially picking up a cancer at an early stage far outweighs the small risk of the radiation exposure.
Now, Winsong offers a lot of great services. Now, perhaps they may not be familiar with the lung cancer screening program. Why do you think that is?
You know, I don't know. I think a lot of it is patients are scared to get the exam done, and that's manifested in the numbers. I mean, there's actually an article just came out only about 8 to 16% of patients who are eligible for a low-dose CT actually get one. And we ask ourselves that question every day, like, why wouldn't you come in? It's free. It's potentially going to save your life. Why wouldn't you come in? And I don't really know the answer to that, Samantha. I think part of it is fear, part of it's lack of education, lack of information, and hopefully this talk today will hopefully push people to encourage people to get a low-dose CT.
Absolutely. You've already driven the message home that there's nothing to be afraid of, and all of the benefits outweigh any type of being uncomfortable for a short-term moment, correct?
Absolutely.
So, doctor, a lot of people still smoke. There's the information, the research is out. We know what smoking does to you. Why do you think people still smoke after we know that it can lead to cancer?
Well, I think a lot of people start picking up smoking at a very young age, and it's an addictive thing. And unfortunately, it's very hard to quit. There's an enjoyment in smoking, and I think that's one reason to do the low-dose CT program, of course, to pick up early-stage lung cancers. But just as importantly, if not more importantly, of course, it's important for people to stop smoking. At Windsong, we actually offer smoking cessation programs 4 times in May and 4 times in October, and during the pandemic, they're all held via Zoom. So it's very easy to do. Call the number and sign up. And I think there are actually trained facilitators at these programs, encouraging people and telling people why they should quit, and more importantly, how they can quit, and providing them all those resources. So I think people want to quit, but it's challenging to quit.
It's an addiction.
And it's an addiction. And I think people need professional help in that regard. So I think we can help. In medicine, we can. We talk about curing disease, but in this particular respect, I think you can really provide a preventative measure by having people stop smoking with these smoking cessation programs.
Absolutely. The smoking cessation will help them with the extra support with the cessation classes, and have the professional help them, lead them into stepping away slowly from smoking.
Absolutely. I think there's a certain stigma associated with smoking, but I think
Absolutely.
if you're a smoker, you have to understand that you're not alone. There are millions of your fellow Americans who smoke. And especially for the older people, smoking was very common, especially during their childhood. So I think it's, you shouldn't feel bad about it, shouldn't be guilty about it. Do the right thing for you, your friends, and your family. Go to attend one of these smoking cessation programs and quit.
I have some health problems that we're assuming that they are from smoking for all those years. I smoked for 42 years. So I would tell people to quit, number one, for health reasons. I went to Windsong one evening to get an MRI of my back, and there was a flyer on the side there that said they were having smoking cessation classes. And I tried quitting for years and never was successful with it. So I said, well, I'll call and see what it entails. So I did, and talked to Tracy, and I said, well, I'll sign up and just see what the class is like. So I did, and I successfully quit. You have to have a plan, and I didn't know how to have a plan. I bought nicotine gum or lozenges, but I would just use it every once in a while. But we teach you how to develop a plan and set a date, and you have to be motivated. And then you have a support system too. So they give you a lot of tips during the classes. So each week focuses on something different. And then we give them handouts too, so to take them home. And they can reread them all the time. I know when I quit and I wanted a cigarette, I went back to my booklet and I just read through some of the materials. And then number one, it gives you something to do. And number two, you have that reference in front of you. So each week it's different. They're wonderful. They've been good to me. And if it wasn't for them, I would probably still be smoking. Call Windsong. We're having a class in May. The first through the fourth Tuesday in May.
You can connect with Dr. Chen and Dr. Cherivu at Windsong Radiology. Their phone number is 716-631-2500. About 1 in 8 U.S. women will develop invasive breast cancer over the course of her lifetime. And when it comes to lung cancer, it is 1 in 15 for men and 1 in 17 for women. The statistics speak for themselves. Putting off screening can be dangerous. Prevention is key. Early screening saves lives. I'm Samantha Latshaw. Thanks for watching. Stay safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.